So let's just start off. What is pelvic floor dysfunction? Let's just kind of like put it out there from the broad sense. What is it?
Yeah. All right. So pelvic floor dysfunction. I mean, the pelvic floor is a group of muscles. It's 14 thin little
Hmm.
muscles. And just like you can have dysfunction, you can have, shoulder dysfunction, or you can have, dysfunction in your glutes. Those are muscles. The only difference is we can't see these muscles. So
Hmm.
oftentimes they don't, we don't think about them as a source of our constipation, our bloating, our low back pain, our tight hips, our cold tingly feet, and our inability to control our bladder or to have pain during intercourse. And so when this group of muscles is not working and resting as it should, that's function. Work plus rest equals function. We then have dysfunction.
Got it. And so how does this happen? Like, what's the lead up? I mean, with guys, obviously, there's different things that can happen that can impact urine flow, such as DHT and benign prostate hyperplasia. Women have different issues with pregnancy and having muscle stretch, prolapse uterus. So there may be some different root causes. Can you talk about maybe the different root causes, maybe for your typical female and your typical male, and just kind of contrast those?
Yeah, for sure. So there are some commonalities between the male body and the female body when it comes to pelvic floor dysfunction. And actually, that's where I want to start, because some of the root causes are very simple. We don't
Hmm.
realize, when we put, I think back to like my dad. I used to see him wear his wallet in his back pocket all the time, right? Like the typical farmer. And when that happens, it actually starts to displace our posture. So our pelvis, the bones of the pelvis, um,
I'm going to put
don't.
up on screen here just for listeners so they can see
Yeah,
the pelvic floor. So we have the female one on the right, the male one on the left. Just so people are listening, maybe you can visualize better.
exactly. Yeah. So when you think about the bones of the pelvis, a lot of people don't realize when there's asymmetry in the bones, the muscles are going to respond. Some of the muscles are going to get tighter in relation to where those bones are living. Some are not going to work as much. Even putting our phone in our back pocket, ladies, those of us who chose to be moms, we've had our little toddlers resting on our hips for how many years? All of those regular day-to-day activities impact pelvic floor. Um, we don't really realize that our hydration, when we are in a state of dehydration, these muscles become very dysfunctional. There's fascial tissue that's this beautiful connective tissue around all of these muscles. And when our fascia it should be like a beautiful spider web. When it's not, it sticks to these muscles in a man's body, in a woman's body, and it restricts blood flow. Well, guess
Hmm.
what, gang? Blood flow is the body's natural way of healing. It's got oxygen, it's got nutrients. It's like taking away sunlight and water from a plant. That plant
Hmm.
is not going to flourish. It's exactly the same. All right. So, I mean, other root causes, any sort of, prostate dysfunction, prostate cancer. If you've had a prostate surgery, that definitely can impact the pelvic floor, incontinence. Sitting at a desk, riding, if the cyclists that are out there, the horseback riders that are out there, all of those regular day-to-day life things that we would never probably in a million years connect the dot back to pelvic floor dysfunction actually plays a huge role. And then there's the ones we basically we know just from what we know: childbirth, women getting into
Right.
perimenopause and postmenopause. As our hormones start to change, it changes the tissues, it changes the dryness of the
Yes.
vagina. All of those can be contributing factors